Hey you guys, so today we're going to be talking about selecting, administering, and scoring tests. And a lot of this, I think it's not going to be review, but it's going to be kind of like review because as we've been doing this stuff previously, we've been talking about these kind of things. So there's going to be some review, and I'll try and skip past some of that to make it as quick as possible. But um, we will start with just some basic ground level stuff, some general comments. So there's a couple of reasons why you might want to care about this. I've been saying in classes that there's some times in which you don't need to collect tests that you don't need, right? And also partially you don't need to collect anything because likely you'll be getting out with supervisors and internships and be getting your first jobs, and you'll have some guidance on what you'll need to be able to assess. A lot of the forms that we're using in class, you'll get to see those in practice out, and someone will tell you like how to use these, not necessarily how to use them, but which ones to use. In other words, it'll be common for you to get to a site and they'll say we use the PHQ, so you should probably collect that information, and they'll expect you to know how to do that, which we've had some practice with. So um, there are some other reasons why you might want to use these, because even though you'll have the PHQ, you might have other clients who specifically ask for a diagnosis, or they want some more information on a topic, or you find out they have an eating disorder, or they think they might be experiencing some kind of symptom. And you get to say, well, let's pull out the DSM and we can talk about that if you want to, or if it's not age appropriate to do that for whatever reason. You might also just say, well, let's run through this assessment to see if we can get some more information about it and help you identify whether it is or is not a condition, but then what we do with the experience that you're having if it's not, something like that. So you may want to build a small library of options just so that you can work through some of those things. And I've told you guys all that you can take the Google Drive stuff that I have available with all those assessments that I'm collecting and the ones that we're finding through class. You'll get to see more of that when we get to our final paper too. If you'll be finding some of your own if you need to, and then you can start building your own little library. But with these kind of things, you can either wait and find out from other people whether it's relevant, or you can just have them on hand and save them somewhere just in case. So that might be something to think about. In one of our classes, I don't remember which one off the top of my head, but one of the classes, we also talked a little bit about future payment structures for practices. I suspect that some of you are going to get out into the field and you're going to be working, and you're just going to have a W-2 job where you get paid like an employee to take your taxes out, and you're just going to do that. And that's a wonderful option for those of us that don't want to deal with the extra crap of having a practice. Like all the extra requirements for like marketing and getting referrals and all that kind of stuff. It's extra layer of complication, right? But for those of you that do want to do that kind of stuff, you might be thinking, okay, well, I get my referrals from, I have a Psychology Today post and I have a website up, and I now have clients, but I've reached this ceiling where I can't really earn any more that insurance wants to provide me unless I want to take on private pay clients, which you can charge a little bit more for sometimes. If you want to develop specific referrals with certain kinds of organizations or clients, like for example, some people will say, okay, I'm seeing clients, I have a caseload, but I also want to develop an EAP contract with somebody, which means employment assistance program, which is basically a benefit that companies will give their employees. And sometimes in some states, depending on how they work it, there's all kinds of different arrangements. But if you have a company that has 100 employees and they want to provide this service for their clients, they might say, well, we'll contract with a specific practice. Usually it's bigger companies, but that's not always the case. And you might say, well, I get to negotiate my own rates with that specific company instead of an insurance company. Does that make sense? So you get to decide how you want to transfer expenses and diversify your income. What that means for this context is that some of you might decide to offer evaluations. Like, for example, some of the evaluations that people often go see psychologists for are the more complicated ones, like ADHD diagnoses. You want to use like intelligence tests for that kind of stuff, autism diagnoses, that kind of thing. If you have special expertise in a certain area, like for example, mine is in career counseling, I can do a lot more career evaluation than most mental health or school counselors are trained for. Although I think we're trained pretty good here in our program with Ola doing the career class. She's really into that stuff. But with that said, if you want to be able to charge a little bit more for an evaluation so that you can offset the cost of taking in sliding scale fees or pro bono clients, something like that, that means you can either earn more or you can balance out your referral sources and get different kinds of services that you'll provide to clients. It's that kind of stuff. And right now, probably most of us are not thinking about that at all. It's not on our radar. But later on, you might be. So, this is one thing that you may want to pay attention to, not for now per se, but later on, it might become relevant to you that I might want to provide a certain kind of assessment for clients. And I need to have a different skill set for that kind of thing. It's not really different, but it's more advanced assessment practices than what we're doing here just in class. So you'll want to pick up on some of this stuff. Um, so I guess maybe one final thing to say about that is this is kind of if you do just collect the assessments for now and you're following along in class and you think I could probably do this kind of stuff, it's almost like a future investment in yourself. Also, in addition to just getting the bare minimum for what you need for a therapy practice, so something to consider. Um, and the last point here that the number three we've talked about before, and we're talking about plenty in this class. I haven't done that as much in the past, but this is just the idea that there's formal and informal assessment, and we can gather information in all kinds of ways. So whether you want to build your library of formal assessments to supplement the informal practices of questioning and information gathering you're getting through informational interviews, then that's great. So just an option for you. Okay. This is all the really generic stuff, and these are kind of like tedious logistical planning kinds of things that you'll want to consider, but it's hard to talk about them now in a way that's really relevant to you because later on you'll have so many, depending on where you end up, you'll have so many different and unique circumstances to your practice that it's hard to really identify what to think about now that you'll need to think about later. So it's a little bit weird, but I'm going to go over this generally. And then this is something that you may want to pull out later if you're kind of coming back to this of like, what do I need to consider here that I'm not considering when I'm selecting an assessment? Okay. So identify the type of information you need. I think that's relatively straightforward, although not always. So it's straightforward in the sense that if I want to provide an assessment for autism, I need to find out what autism or what scales people are using for folks on the spectrum or ADHD. What training do I need on specific assessment tools in order to be able to use them in my diagnosis or something like that. Um, in addition to that, the not so straightforward stuff, and we'll see this again when we get to our final paper, but if you're doing a diagnostic evaluation on children, like let's say children for ADHD in school, which most of us are not going to do, but it's just for sake of example, you're probably going to want to know a lot about their educational performance. Like, what does this look like in classrooms? What are the teachers seeing? What are the parents seeing at home? That kind of stuff. So you'll need that kind of information to be able to make a good diagnosis, right? But if you're working specifically with adults and eating disorders, their educational background likely won't have as much impact. If you're doing a career evaluation, you'll want to know a lot about their work history. But if you're doing a diagnosis for depression or anxiety, their work history and where they've worked and what kind of work they did and what their income was really isn't going to be all that relevant. So we'll get some practice with that kind of thing when we get to the final paper. But right now, just kind of log away that there are different kinds of information and you get to choose what's relevant or not. And that's what I'll help you with too when we get there. There's lots of different sources for information like records, your intake interviews, and also collateral sources. And what that means is essentially like parents, teachers, other providers, past therapists, psychiatrists, medical doctors, and the list goes on of all the different places you can get information. How much you need really depends on the complication of what you're working with or the circumstances. So, like for example, um, when I'm doing career evaluations, I really want to get like a past resume if a person has one. It's not uncommon for people to not have one, especially if you're working with teenagers, right? They haven't done one yet. I may also want to see what's a good example? Like if somebody has, for example, I've worked with plenty of clients who have diabetes, and sometimes when working through a career evaluation, I want to know a little bit about their medical history because if I know what their diabetes diagnosis is and what that really looks like for them, I can get a lot of that by just having them tell me. but some clients have a hard time describing, like, here are my limitations, like my feet just hurt, or, I'm starting to lose my eyesight, two common things that happen with late stage type 2 diabetes. So if that's happening, sometimes it's helpful to get some of those medical records. Okay. Another thing that's pretty common too that you might consider is that if you're working through a diagnosis and someone says, I've been to different providers and I've had this for a long time and I take some meds. I don't remember really what they're called. It might be helpful to get a list of their medications from your doctor to help, or from their doctor, sorry, not yours, from their doctor to be able to help understand what are the medications, how long have they been on them, how much are they transitioning from one medication to the other to rule out medication induced psychoses or hallucinations or depressions or something like that. So getting that kind of collateral information from records or from other people can be really helpful. Okay. Um, just so I don't completely overwhelm you though, most people get most of what they need from just talking to the client. Unless you're working with younger kids, then parents are often the most common. Teachers, sometimes, if you're in schools, absolutely, that's a place you're going to be getting this. Even school nurses or dean of students, they can be really helpful too. So, something to consider. Determining the method for obtaining information, both formal and informal, we've covered that one, so I'm not going to say much more about that. Last week, we discussed PAR and Pearson, so all of you have seen those websites, but those are just places where you can buy assessments. Again, that's a thing that you would want to do some financial consideration, some budgeting, whether you can get money from a school to provide a service. Usually that's not really something that a lot of people do, although especially for you school counselors, you'll be considering, you might be asked to say, can you help me figure out how to evaluate the health of our students for some grant that the school's applying for or something? And you might have some valuable input with your principals or your superintendents or whoever makes those decisions. So knowing about these can help you make some of those financial decisions of where the costs come from and that kind of thing. The mental measurement yearbook is something that honestly I've heard a ton about. People have said this is a great source for assessment information, but I've never seen a clinical utility for it. It's more, at least as far as I know, and I feel like I'm wildly unprepared to talk about this with any kind of authority. But in my experience, it's been more useful for people doing research or wanting to collect a different kind of data. But it's just not all that common for people to go digging through it unless you're doing research. Because if you're doing research, there's a lot of nuance in the kind of information you're gathering. But in practices, it's usually a little bit less unclear, I guess. Maybe that's not the right way to say that. But research literature, you can often find researchers who are doing studies on bipolar or studies on eating disorders or some of the more complicated ones that you just don't see as often, like, for example, trichotillomania, which is hair pulling, or pica, which is eating foreign objects, that kind of stuff. If you go look for the research and see how are people assessing that, you can find different tools for how to do that. Another one that came up recently that I learned about was postpartum depression, and also prepartum depression is something that I've heard something about, which isn't the same as just regular depression, but it kind of is. And there's complications that I don't fully understand yet. But that's just an example of something where you might find through the literature something else that could be useful to you rather than just the PHQ or something like that. Internet searches, of course, you guys know how to do that. Professional organizations, and I'll skip down a few to, well, we can just include these, I guess, textbooks, colleagues. Professional organizations are filled with colleagues, also Facebook groups, people like that. Just ask around, build your network, build people who have these same specialties. In fact, I've done this before where I've just Googled nationwide, who are other people that do this very niche thing? And then I ask them. In fact, somebody just recently told me about a group down in Louisiana that really specializes in obsessive compulsive disorders. And they reached out to them and said, what are the tools that or I reached out to them after they told me, and they said, what are the tools that you guys use to do assessment for obsessive compulsive disorder? And I got information like that. So it takes a little bit of digging, but once you know how to dig, you can find quite a bit of stuff. Okay. Consider culture and diversity concerns when selecting assessments. That's why we go through the reliability and validity stuff and talk about normal curves and how to understand normative data. We kind of skipped over this in the past class period, but if you go look in your testing manuals or look through the research, it will tell you this study was conducted on college students age 19 to 24, and that's it. And you're like, well, then can I use this for like a second generation immigrant family from Guatemala? I mean, kind of, but maybe not, right? Like that's so you get to make those decisions too. Um, that would be one thing that we can talk a little bit more about because oftentimes I get a lot of questions about that from students who are like, but if it wasn't tested on somebody, can you really use it? And the answer is, well, if a pair of pliers wasn't specifically developed for pulling out screws out of wood, but you can grab onto them and turn and pull the screw out, are you allowed to use it? The answer is yes, but it's not really specifically made for that. But do you get the information you want? Requires a little bit of ingenuity and creativity on your part. Okay, so if you're concerned about that, let's take a look at some of those things and see if we can practice with them, find something out. Um, and then in selecting your assessments, you're also thinking, how long can I expect people to take this assessment? In other words, if I need to do an in-depth thing, I could expect a person to take an assessment for a half hour, an hour. But if I need to collect this from kids, they're not going to have the attention span for that. So I have to figure out, I need like a short, fast, quick, and easy assessment that only takes about 5 minutes, something like that. So your instrument strategy is kind of important for those kind of things. And then there's evaluating the instrument. That's why we went over reliability and validity last week. And again, we didn't have as much practice on that because we practiced with some other things. But here are some things to consider. What's the purpose of the instrument? Pretty straightforward. Who's the intended population? If you're using PAR or Pearson, oftentimes they'll tell you adults between these ages. And oftentimes that's enough. Most of the time, that's enough. What's the makeup of the norm group? That's what we just talked about just a second ago. Are the results of the instrument reliable? That was the content of last week, reliability and validity. Remember those, is it 0.9? Does that mean it's a good validity? Well, that's off the charts for validity, but reliability, that's an excellent uh, number for reliability. So knowing how to look for those numbers, that's can be a helpful thing. Do the instrument result, uh, oh, validity is number 4, so we'll just skip that one. Does the manual provide clear and detailed information about administration procedures? This is one thing that we didn't do a whole lot of practice with, but if you have a new assessment, they'll tell you how to use it. It just takes a little bit of time and study, just like you do in classes, to read through and say, okay, let me practice this one. And here's the test tool. Let me walk through it with somebody like a peer or some innocent victim. Innocent, not a client. That's the difference, right? You don't charge somebody to practice on them, but you can take it yourself. You can find a friend. You can, just say, walk through this so I can get used to the procedures. And that's totally reasonable to do. Okay. Um, and the manual provides sufficient information about scoring, interpreting, and reporting results. If it doesn't, then, which isn't totally uncommon, sometimes you'll find tests that are really pretty straightforward. You add up or maybe subtract for negative responses. In other words, if someone says yes to this question, you add. If someone says yes to another question, you have to subtract based on how they organize the information. But simple addition and subtraction like that, come up with a score. Here's what the score means. And then you can do a lot of that interpretation yourself. Others require a little bit more doing, and I can show you some examples of more complicated ones. Um, but is there enough information to be able to actually do that? And if not, then you'll need some additional training, right? Most of the training that you'll get in this class, and I think you're all pretty capable of it. It's a little scary because it feels technical in a way that we're not always trained for, and you see all this statistical information and this in a language of assessment, which is slightly different than the way we think clinically sometimes. So it can be intimidating, but I don't think it's beyond your capacity to be able to do these things for most of us. Some of us just don't want to do that or don't think that way. And then you could use some more help, but others can figure this out. So that's okay to be that either way. Is the instrument biased? I think that one goes up to reliability and validity and the norm group kind of stuff, but it's a worthy consideration to take in mind. And then, of course, the level of competency that is needed for that instrument. We ran into some situations where it said competency level S on the PAR website. Um, and that was like specific training required or something like that. I'd never seen that before, so that was new to me, but um, something to look into. Can you actually do this? Can you purchase it? Oftentimes, if you can purchase it, those safeguards are in place, and if you can purchase it, it's possible that you're capable of doing it, or likely that you're capable of doing it. Although I gave an example in a past lecture, I think it was, where I have a PhD, so I can buy level C tests, but that doesn't mean that I'm really competent in knowing how to use them all. Or if they're more complicated ones, I would need some specific training and probably supervision to be able to use it really effectively. So there are those considerations too. If you're not sure, just ask around. Ask people that are close to you, although there is a lot of controversy around assessment. So don't just ask one person and take that as gospel. Ask other people too. I referenced this Carl's email. I'm not going to show you that, but a few years ago, Carl's the guy. I don't have my book in front of me, but Carl's the guy who wrote our textbook, and he was on a professional listserv, and they. I don't. I don't mean any. I don't mean to be disparaging towards people or be rude or mean, but like I call these nerd fights sometimes because you go to conferences and people have these like professional debates about who can do what and what the professional identity of counselors is who can assess who can't. So there's one of these going on a professional listserv, and some people were saying we're not trained to do these complicated assessments. We don't know how to do this stuff. And Carl was like, well, but look at this. Look at the textbook information that we have, the things we're teaching to students. I get that people don't have confidence, but they have all the skills and resources to be able to do these things. So yes, we can. And so they were having this debate over like, what kind of assessment we can do and what we can't do. There's quite a few people out in the field practicing who went through school and did not get good training and didn't feel like they're confident enough to perform some of the assessments that psychologists will say, we do these, don't worry about it. Well, you can just refer out to us. And so a lot of people think we can't do ADHD assessments. We can't use intelligence tests. We can't do autism assessments. And that's true if you don't think you're capable of it, but it doesn't mean that you're unqualified based on your training. So there's a whole bunch of gray area, and which is why I say get some other opinions and talk to multiple people about what you can and can't actually do. It's also why I showed you at the beginning of the semester the actual laws that say you're legally allowed to do some of these tests, but in ethics class, you might have looked at some of the ethical requirements that say ethically you should probably get supervision, and then personally you're like, nope, not doing it because I don't feel good. But you're legally allowed to, and with the right supervision, it's ethically okay too. So there are some of these gray areas where if you're informed about the law, you understand how to look for the ethical complications, then you can get these and perform them with people, especially if you're going to get additional training in a specific kind of modality or a specific kind of population, then you can have a whole bunch of background knowledge that'll help to know, what do I look for? What do I need to consider? And then you find a tool that can consider those things and you're capable of doing it. So there's a lot of gray area in this lecture, which is why you might be asking questions of like, I'm not really uh, can I do this kind of assessment? Or I imagine a lot of you are going to be thinking, I don't even know what question to ask. And that's okay. That's why this is to put in our back pocket for later too. There are some practical considerations. The time required for administration, that's one thing I referenced earlier. 5 minutes versus an hour is kind of a big deal. Not only does that mean, does a person have the time? Like, can I leave my homeroom for long enough to take an assessment? Especially if for those of you that might be doing some career evaluations with high school students. I think Ashley, we talked about that last week a little bit. Some of those will take 15 to 20 minutes, and then you'll want to have time to talk about it. So you think about like, how long will it take to administer? And then how long do I have to discuss? And maybe that means we have to plan for like 2-hour homeroom hours or whatever it is to talk through these things, because it takes a little longer. High school students can also sit for tests a little bit longer, especially if they are motivated to do it. So ease of administration. What do I want to say about that? Sometimes it's easier on clients if you walk them through an assessment, but if they have to go onto a computer, that can be a little different. If they're really savvy with computers and comfortable with them, great. If they're not really sure how to use a computer, especially with some of the older clients or people that don't read or write or something like that, that would make administration very difficult, right? If somebody needs an accommodation for some kind of disability, that challenges the way in which we can administer things, and those are considerations to take in mind. Um, Ease of scoring, that's not as big of a deal nowadays because mostly computers do these things. It used to be that scoring took a while. So the reason that was relevant is that if a client comes in, they take this test and they're like, so how did I do? Like, what does this mean? What do I, and you're like, well, it's going to take me about 5 to 10 minutes or maybe longer to use the manual to transfer some numbers and then do some basic math calculations and then come up with the actual number. Again, not as big of a deal these days, but it still might be relevant to some of you. Um, and so, specifically, what that can mean is that a client comes in, takes a test, and then you can't get the results to them right away because you have to not only do the scoring, but then also like, what does this mean with these other tests, and then write your reports, that kind of thing. So, if you're getting into more complicated assessment procedures, then you'll need some time to do that. Um, So I think with what I've said, most of these will make sense. Ease of interpretations, so what I just said, the format of the test, depending on accommodations or age level, that might matter. The readability, same kind of consideration. And then the cost of the instrument, we've already talked about that too. So um, if you're specifically trying to work with people who are let's say like lower on the SES scale, you're working in an addictions population or something like that. You tend to get people who either don't have insurance or they can't afford things. Then you can't really expect them to take a really expensive test unless you have funding, right, to help offset that or something. So those are important considerations to take in mind. These ones I think are relatively straightforward, but um, thinking about accommodations if a person has a disability of some kind, whether you need to have an interpreter in there with you, interpreting for the client, whether they're children who don't have, um, like, have a harder time spelling, something like that. There are all kinds of reasons why self administration can be tricky. In most cases, it's not usually a thing for most of us, but it's something to keep in mind. Um, one place that comes up is if you're working in schools and you have to assess a whole bunch of students for their like future career potential or something like that, who's interested in going to college or whatever the reason is. You might be able to assess like 95% of the student population, but then you have a special ed group that needs specific accommodations, so you'll need to consider those things for that small group to make sure you have a representative sample of everybody. Individual administration, group administration, computer, video administered. And I'm kind of thinking there are some times when you want to just play a video to read the instructions to people so that you don't have to verbatim read out of a manual or something like that. But if somebody can't hear or can't see and the video needs captions, these are all nuanced kind of things that you may need to consider. Same thing with audio, ASL, American Sign Language, or working with nonverbal clients. These are all things that you may encounter later on that you have to think about. So, um, this is a big one, informed consent. This always brings questions up of how much consent and in what way. And it's really not, there's no standardized answer for how to do this. Um, this might be something that I've done this really casually in class a few times, but maybe that's something I kind of make an example of. I'll see if I can come up with an example here as I'm going through this, but here is a list of things that are helpful and probably important to talk about, but the depth and the nuance that you give to how you discuss these things depends largely on what the client is interested in, what they're capable of understanding, what um, the utility of the information to them. So, like, informing people about what's going on is important. Also, I don't know if you've been to the doctor's office recently and they said, here's a HIPAA thing. And you're like, well, can you explain to me how you guys manage your data and who you send it to and what it gets used for? And will I be put on a list? And can you explain to me the policies and the procedures? And like, nobody does that. You just sign the stupid thing and move on with your life. You know what I mean? Most clients are like that too. We may think it's really important that I tell them about the purpose of the instrument and the criteria used for selecting the instrument and the conditions under which the instrument is taken and all that kind of stuff. But their interest in that varies greatly, okay? Um, I'm going to read these off and then I'll give you some examples of what this might sound like. So, the range of skills or domains to be measured, the administration procedures or concerns, types of questions on the instrument and how and an overview of them, types of scoring methods, scheduling for reporting, or the results of the test taker. Okay, so here's how this might look with the PHQ. Client comes in and you say, great to meet you, go through the kind of small talky stuff, and you say, one of the important things I want to do to, given what I already have learned about you just a little bit, is I want to make sure that we do a good assessment for depression, because if you have it, that depends, that it matters for how you pay for an insurance bills, but also how we do our work together. So I would love to use this assessment. It's called the PHQ, and it's going to be just a few questions. It's not going to take very long, and you can either just take it if you want to, or I can walk through it with you. And if you don't know what the best way is, then feel free, we can talk about that. We'll do it right here. And so there's no need to take it with you. And the questions, if you're not understanding them, then we can talk about them. And then afterwards, I'll explain to you what the score means. Okay. So right there in that simple little explanation, which didn't feel the cleanest to me, and it oftentimes comes out a little bit differently. But I said the purposes for depression. I didn't talk about the criteria for selecting it because I just don't think it's necessarily relevant. But if they want to ask, sure. Everybody uses this. It's a very common thing. Most people are familiar with having done something like it at the doctor's office or whatever. So I kind of skip over that one. Number 3, we're going to take the test right here together. Either you can do it or I'll walk you through it. You might not even ask that question. If you just have a comfortability with the way you do it, then that's fine. Or if they do it in the office beforehand, or the waiting room beforehand, then you don't even need to talk about that one. So hopefully you can kind of see how this doesn't have to be a complicated thing. And in some cases, you may need to very specifically walk through all these things. Like, I'm going to have to take some time to score this afterwards. So I'll send you the results later, and then I'll have to schedule another appointment for us to get together and talk about it. Okay. Once you get into doing this and you learn this process in your internship or your first job, after a while, these things kind of become second nature. But this list, it might look intimidating now, and later on, you'll probably be covering a lot of these things, or you can just come back here and say, what have I missed? What do I need to take into consideration? And then lastly, this one, this building rapport thing is really important. I'm going to get out of the way so you can see the whole sentence. It's such a priority, and this is why we practice how we talk about these things, because, and we've talked about this in class, so I don't need to labor on this one too much, but if you are very procedurally oriented and the client is kind of freaked out and they're really nervous, then going through a list of all these things and reading off of your manuals and shoving paper at them is pretty scary and weird. And it does also feel like there's some disconnection that happens there, especially like we talked in class, at least one of the classes, about the times where you took a test and then nobody ever talked to you about it again. And you're like, why did I even waste my time doing that? Could I have just ignored it? You know? Or somebody talks to you in like really jargony kind of language, or talks over your head or your understanding level, then you just kind of tune out and you're like, that person wasn't very helpful. I do this when I go to the doctor's office with my mom. Sometimes she's like, the doctor told me some things, but I don't really understand all the things they told me. So I just hope they're nice and they take care of me. You know, it's that kind of the spirit of that kind of thing is why we build rapport, and why we say, let's do this in a way that says, here's a test. It's not going to be scary. Hopefully we can take this together and we'll talk about it together, and there's no real surprises here. And if there is a surprise, that's what we get to spend time dealing with together. Okay. So building rapport is really, really important because the relationship is king. Okay. Scoring. You will know about the assessment before you give it to someone. Again, I mentioned this earlier. You want to get used to the administration procedures and how to score things. So before you're using it with people, so you know what you're doing. That's really important. I already mentioned that formal instruments have scoring procedures, usually in the manuals. No professional judgment. So that part is something we will get practice with on our final paper a little bit. But that really means professional judgment means clinical judgment, which means your interpretation of what's going on here. And that heavily relies on your understanding of human change, about your theory, your theoretical orientation, that kind of stuff. The assessment procedures will tell you, here's how you use the assessment, but we're not going to tell you what it means. That's often what new people to assessment think they want to know. They're like, okay, what does this information mean? The book's not telling me. Or it'll tell you something, but how do I then apply that to the unique circumstances of my client? That's what we need to practice, and that's what you'll take some time to get used to as you start doing these out in the field, okay? It can be kind of frustrating and really intimidating, and I think why people shy away from assessment, because if we give you the foundations here, and then you're out on your own, kind of, in often you'll be under supervision, but even if you're under supervision, you're like, okay, what sense do I make of this? It can be really scary to do that on your own and be like, is this good? Am I doing something helpful? How do I deal with this? Okay. So we're going to practice here, but I just want to fully give you permission to feel scared, to be overwhelmed, to feel like you're incompetent, and all of those things because of the way this training works. And I want to encourage all of you to say, I think we can do this. So we'll practice here a little bit and hopefully give you some base level understanding of what you can and can't do. But that's a really normal experience, to be kind of annoyed that they won't give you any kind of professional opinion about the meaning, right? One thing we'll talk about later too is it's tempting to copy and paste the results of a test, which this might sound kind of complicated or contradictory to what I'll say in class, but it's tempting to copy and paste like, this is the result of the test and here's what it means to you, without inputting your specific understanding of the nuances and circumstances that people live with, okay? You can copy and paste in many circumstances, but also what we'll practice recognizing is, when do I need to layer on my professional judgment, which means how I'm understanding this, which directly relates to how we are going to treat it. In this class, we're not going to talk a whole lot about treatment because we're all going to treat things in slightly different ways depending on our theoretical orientation and our counseling style. So it's hard to talk about that, but we can talk about, if I give this test and I talk to the client, here's what the test results are, but then really specifically, here's what it means to us. Here's what we're going to do with it. Here's how we're going to apply it and understand it based on what we know, okay? That can be a scary thing, so just want to acknowledge that. So this number 3 really talks about controlling for bias. I think that's something that if I've talked about it enough, so I'm going to skip over it for now. But if you have questions about that, let's talk about that in class. Let's have a discussion about that, because it's such a nuanced conversation of whether you choose the assessment in the first place. And if you do, you'll kind of probably have an idea of what you want to do with it. And if you don't, then you're not going to have this discussion. So it's really a tricky thing to talk about right now. But this question, do you use a standardized procedure for scoring, or is it just based on your opinions at the time? That's one of those things that you can mention to people of like, okay, with this assessment, remember that PHQ that we took just a little bit ago? That one, we can interpret that how we need to, and I'll help you walk through what I'm understanding out of this. This other test, it's really important that we follow the procedures equally, because it's important to know how you compare to other people in order to get this good score. In other words, if anybody else has this condition based on the way we understand it, I want to make sure that you get the right kind of information. So I have to ask this question just like it says on the paper. Are you going to be okay with that? Sure, yeah, that's fine. And then you just sort of read the question, right? So if somebody says, how do I know these are good results? And you say, well, it's because I read it the same way that every other therapist reads these questions, or school counselors reads these questions. So if we're all reading the question the same way, we're getting the same kind of information from people, hopefully. So there's ways to describe that, but we can talk about it if you want to a little more. The book emphasizes this, that you will make scoring errors. Most of us put off our documenting until after session, which is a good idea probably to do. Sometimes we put it off to the end of the day. Some of you will put it off till the end of the week and then spend an entire day going back and documenting. Not recommended. 1 out of 5 stars. 0 out of 5 stars really, but some of us will do it. And some of us just don't keep up with the documentation and get kind of sloppy with it. And that's not ideal in any of those cases. Even if you're like really organized and efficient with your time, you'll still make mistakes. In fact, you guys have seen me make plenty of them probably by now because it's just a normal thing that I do. But you will make mistakes. How do we prevent and correct for these? That's kind of the question, right? Computers help because they can do some automatic scoring, and that helps a lot. But there are circumstances in which you might need to think about, how do I safeguard myself from making mistakes? In other words, don't put off your assessment scoring. Don't put off your documentation. If you are exceptionally tired or you have some stressors going on in your life, you'll probably still feel the pressure to get your work done on time, and that's good. But maybe consider doing that at a different time of day or after you've had a cup of coffee or something like that. Those are things that can kind of help. So I'm just going to check time. Okay, we only got one more. We're doing great. Interpreting assessment results. Intimately know the test and these subscales. I think we've kind of talked about that enough. Know the terms and the language of the test. If you practice it, you'll get to know the terms. If you don't know something, just look it up. There have been times in class for both of our classes where I've said, "Hey, there's information here I don't know." And I jokingly, kind of flippantly say like, well, if I don't know about it, it doesn't matter, or I'll look it up or something, you know? When I do actually use a test, I go read through the manual. If there's stuff I don't know, I'll go see if I can figure out what it means or determine if it's necessary for me to know that. Like if I'm going to look back at the reliability and validity, I feel pretty comfortable if it says it has strong validity or strong reliability. I don't need to go look through all the statistics to say, well, let me see if those studies are actually correct. I can kind of skip over some of that. But in terms of what all the subscales are, if I'm going to use these things with a client, I'll want to know what the subscales are so I'm not missing something. Pretty important, right? So you do your research and you learn about these things. Oh, by the way, something I didn't talk about earlier, I'll mention this. How do you evaluate an instrument? Also consider how much time it's going to take you to learn these things. If you have to take a special training and pay for that, that also adds to the cost. If it takes you 3 or 4 hours to read through these things and practice with them and get up to speed, it might be worth considering your time and how valuable that is in terms of the cost and the difficulty of onboarding an assessment or facilitating the process, something like that. So worth thinking about. Know how to read the score reports, percentiles, T-scores, and all the other parts to it, which is what we've been practicing in class. We've talked about this slightly, but we'll talk about it more. Avoid using a single test score to make determinations about diagnosis, career decisions, attributes about a person, okay? It's super important. Get multiple kinds of information to make decisions, valuations, or judgments, okay? Having said that, some of you will have to make a diagnosis after somebody takes a PHQ or GAD-7 in the waiting room and then comes into you for 1 hour where you have to collect all the information that you need. Some of you will have a very structured form that you go through that collects a whole bunch of information. And you're like, yeah, I have to collect their medical history because I'm told I'm supposed to. But the actual thing they're coming in for is relationship advice. And so sometimes we can have this tendency to sort of like, say, well, we'll make the diagnosis based on the PHQ because that's enough, because that'll help pay for their services. We'll call it depression or we'll call it an adjustment disorder just so that the insurance company can kind of back off a little bit. And they have symptoms and it's a legit thing. But that's not really what we're doing here. And so there's a tendency to want to throw it away or put it aside and just use that one single test score. Now, here's the thing. That some of us are going to look at this and say, no, you need to have all kinds of information. And you probably do. Your clinical judgment is important and it matters and you have skills. It's one of the harder things for us to get used to because so often we're overwhelmed by this new information in a program and it takes a while, maybe say 3,000 hours of practice to be ready to be independently licensed so that we can take confidence in our clinical judgment in addition to these tests that we may use, right? That's okay. And so there's varying opinions about, do I need more information? Is it okay just to use my clinical judgment? Can I just go through the DSM and say, I recognize this in the behavior of a person? And yes, it is okay. And that's why this stuff is so hard to talk about because Sometimes you need to get a bunch more information. Other times you need to make decisions with limited data. So both of those things are true, and how you do that in practice really depends on your skills, your abilities, client needs, that kind of stuff. So that's maybe worth a conversation if you guys want to have that. Do not use interpretive reports or your as your clinical judgment. What I mean by that is that all of us have taken the Myers-Briggs and then we've looked at the output of the Myers-Briggs and says, this is your personality. And that's not that big of a deal because people know that they have to like interpret that in their own way. But when it comes to things like diagnoses or other kinds of personality tests, they'll give you like, this is your clinical impression. Like, for example, maybe I'll show you an example of the MMPI. It has these like interpretive reports. The MMPI is like this really complicated 400 question. It takes a long time to take it. It's we'll talk about it more later in the personality assessment class or the in that module, whatever. But when you take it, it sometimes gives out this feedback of like, these are your symptoms, this is your condition, this is likely what you look like. But the person may or may not actually fit that profile. That's what we're talking about here. It's sloppy, it's lazy, it's harmful to clients if you don't adapt the content of those kind of things to really fit who the client is. When we do our final papers, I'm going to ask you to do some informational interview with a mock client and then choose some assessments that seem relevant to them and then consider all of that stuff, that family background, what the client says, what they're experiencing, how they're reporting their condition, like all that kind of stuff. And you'll pile that together to say, here's what I think is going on here. Okay. That's the important thing, is that you take the time to really understand them. Not only does it help build rapport, and so they know they're being seen and heard and feel felt, because it's therapeutically required to have that kind of relationship. And we know that. It's just internalizing that when we have pressures from the outside that say, just put this information in and forget about it, and then you can do the real work or something like that, right? So the idea and the reason we harp on wellness and to avoid burnout and self-care is not only for like your own benefit, but it's also for your work quality, your accuracy, and your ability to be present with people and to build strong relationships. It's that kind of stuff. Okay. Um, and then the last one here, use scales within tests to compare to each other. For example, we've done this in class already where we looked at the SCL 90 or the symptom checklist 90, and we said this person's reporting higher somatic complaints and pretty high anxiety complaints and phobia complaints. It kind of checks out because we know that anxiety is often associated with physical stuff, like stomach aches, and people have panic attacks. It feels like you're having a heart attack and they're like, my heart it just races. And so we're like taking that physiological stuff and the explanation of other things, and we just compare them and understand them together. Sometimes you might see things that look off, like, a person with depression says like, oh, I wake up feeling great every day, but I'm just suicidal. And you're like, huh, that seems odd, because most people who are suicidal have a strong indication of other symptoms where they don't feel great. They have hopelessness, they have lowered motivation, they have less interest in pleasurable things. And so it doesn't mean that it's wrong. It just means that we have to take in those discrepancies and say, let's understand what's going on here. We need more information. And that's it. So, what else do I want to say? Nothing. I think that's it. All right. I'll see you guys in class. Bye-bye.